Joining us now to answer some common medical questions is News Channel 5's medical specialist, Dr. David Soria, who's also the Chief of Emergency Medicine at Wellington Regional Medical Center. Thanks for coming in, as always.
You're welcome. Thanks for being here.
Good to see you. Our first question for you today, what's the difference between type 1 and type 2 diabetes?
Very common question. And diabetes mellitus is a disease which the body is not able to push the sugar, the glucose, from the bloodstream into the tissue. Now, there's two types, type 1 and type 2. Type 1 is typically childhood or adolescent derived. It usually starts earlier. And basically what happens is the pancreas just doesn't generate enough insulin for the body to be able to push that glucose in. Right? Type 2 is a little bit different. It occurs later in life. It's called adult onset. And what happens there is the insulin that's being produced is resistant in the tissue. So the sugar just stays in the bloodstream and isn't able to get pushed in. Typically, that arises because of the American lifestyle. Sedentary people get it, obese people can get it. So many times, now, there's over 20 million people that have diabetes in the U.S. Over 90% of those have type 2. So clearly the best way to prevent it is by eating right and a good exercise regimen.
Some control then we have,
no
some
question
over
about
type
it.
2.
That's correct.
Okay, all right. Our second question for you today, sometimes my fingers feel like they've fallen asleep. So what's happening?
You know, it's a very generic question because it can be so many different things. But in general, that is what paresthesias are by definition. It's numbness of the fingers. What that can be is anything from carpal tunnel to Raynaud's disease, to anything going on with the elbow, or even something called, excuse me, thoracic outlet syndrome, or even a pinched nerve in the neck. So the key is to tell your doctor when it occurs, what else happens with it, and where it occurs. So, for example, does it occur in all the fingers? Does it happen in just the pinky finger? What else happens when it occurs? Does your fingers turn cold or blue? Very important to help put the pieces together.
So who would you see for that? Who would you go to for that?
Well, typically, depending upon where or what it is. If it's carpal tunnel, for example, orthopedic surgery, hand surgeon, or a neurologist, or even a neurosurgeon if its origin is in the neck.
I see. Okay, some options there.
Yeah, you bet.
Okay, and our final question today, how do you know if you have food poisoning or if it's just a plain old-fashioned stomach ache?
Yeah, well, a stomach ache is very general as well. That could be anything in the abdomen, whereas food poisoning is specific. That is from eating food that has bacteria or a toxin in it, and what happens is you get nausea, vomiting, and diarrhea. Almost always. It can as well be associated with pain, but you're going to have those three things as well. A stomach ache could be anything from pancreatitis to your gallbladder, an ulcer, appendicitis. So many times what I see is patients will come in and they'll try to ascribe or say that their pain is something that they ate from the day before. I shouldn't have eaten my mother-in-law's chicken. When in reality, all it's done is delayed what can be potentially a serious problem. So if you have that, in those cases, I want you to come in so we can take a look and see what it is.
All right, both options. Pretty yucky.
You got it.
Thanks as always.
You bet.
If you've got a question for Dr. Soria, you can always send it to us by going to our web channel, WPTV.com. Just click on the health link, scroll down to the right-hand side there, and you'll see a form to write him your question. Thanks for coming in. We'll see you next week, and we'll see you right after this break. Stay with us.